Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hi viewers, welcome to the health show Doctor's Voice. This is Dr. Nova along with you in world famous Parkway Cancer Centre, Mount Elizabeth Hospital, Singapore. Everybody wants to be happy in his or her life, but it's not possible to become happy without sound mind in a sound body. We are here to give you the gateway of healthy and happy life. We are very happy to have Dr. Lim Hong Liang, medical oncologist, Parkway Cancer Centre. Let's move to our main discussion. Hello.
Yes, hi.
Greetings from ASATV Bangladesh.
Thank you very much for having me here. Yeah, nice to be here.
You are experienced in lung cancer, and we will talk about cancer, particularly lung cancer. Would you please tell me what are the common causes of lung cancer?
Yes, I think it's very well known to everyone that lung cancer is associated with cigarette smoking. In fact, worldwide, about 80 to 85% of all lung cancer patients are caused by cigarette smoking or tobacco in any form. So if you see the incidence of lung cancers in any countries, it's always correlated with the prevalence of smoking in that population. So smoking, cigarette smoking, tobacco smoking is the number one cause. Other causes are less important, but they're still significant, specifically pollution, the air pollution from the traffic for industry.
And in our country, particularly in Bangladesh, air pollution is a major issue. Our air is very much polluted. And do you think this is the risk factor for us?
Yes, air pollution is definitely the risk factor for lung cancers, but you need to look at the relevance importance. For example, compared with a never smoker, a smoker, the risk of a lung cancer in a smoker is about 15 times the risk of a never smokers. Okay? That's 15 times. It's not 15%, but 15 times.
15 times.
But you look at the risk of, let's say, air pollution, which is similar to actually passive smoking, the risk is actually 1.5 times. It's increased 1.5 times, but it is much lower than being an active smoker. But it's still considered a risk factor.
And in our country, passive smokers are also, there are a lot of passive smokers. And nowadays, there is the issue of third-hand smoker.
Correct, yeah. So smoking or exposure to tobacco smoke will increase the risk of lung cancers. It's a matter of degree. So of course, the most significant is being an active smoker where you inhale the smoke directly from the cigarette. But being a passive smoker, you're also inhaling the secondary smoke. Okay? But as we said, the risk is lower. So cigarette smoking, passive, active, in any way will increase. So also our usual recommendation is, if you are not a smoker, do not start smoking. If you are currently a smoker, stop smoking now. So sometimes it's very difficult in a work environment. In a work environment, in the sense that if your colleague is smoking, do we tell them to stop smoking? So it's probably a bit of, there's cultural difference. Some culture will, they may not be so active at asking the next person to stop smoking, but in some cultures, in different countries, they may do it. Yeah, but the message is, even passive smoking, inhalation of cigarette smoke will increase the risk of lung cancers. If you cannot stop the person from smoking, avoid them.
You have told about inhalation.
Correct.
But another way is chewing, tobacco chewing.
Correct,
And
yeah.
what are the hazards?
Okay, tobacco chewing, I think the exposure is direct in the oral cavity and maybe in the throat, and if you swallow, is in the esophagus. So tobacco chewing will directly increase the risk of the cancer of the oral cavity, the tongue, the gum, and the cheek, the throat, and the esophagus. But it can also increase the risk of lung cancers. In fact, I believe in Bangladesh, lung cancer is probably one of the commonest cancer in at least the males. And I believe the high prevalence of lung cancer in Bangladesh is probably related to the number of people smoking, especially in the males, and the consumption of chewable oral tobacco products. And also, I believe in betel nuts chewing as well.
In case of pregnancy, pregnant mothers sometimes inhale smoking,
Yes.
and how they suffer from, and particularly the fetus.
Correct. I mean, we do not know whether there's such thing as a safe level of inhaled tobacco that is safe or whatever. So the message is to minimize, to avoid at all if you're able to, or to minimize exposure. Yeah. We will not say there is a safe level below which it is safe.
And what are the other risk factors?
Other risk factors are probably less so. Or some people say radon exposure. But these are radiation in the environment that we cannot control. One factor that used to be important is asbestos. Asbestos is a mineral that used to be used in a lot of building materials for insulation in tires. But the link to lung cancer or the lining of the lung, the mesothelioma, has been established many years ago. And since then, asbestos has been banned or people stop using it for its purpose. So exposure is less. But there are still people who are exposed to asbestos 20, 30 years ago. And these people continue to have a very high risk of having lung cancer. So asbestos, yes, it increases the risk of lung cancers, but exposure is less. But because of the previous exposure, so we are still seeing many patients having lung cancer with asbestos exposure. Other industries like silicon, dust disease also increase the risk of lung cancer a little bit.
With your permission, now we will go for a short break. Dear viewers, now it's time for a short break. We'll be back soon. Please stay with us. Dear viewers, welcome back to the health show Doctor's Voice. Thank you for being with us. What are the advanced technology to treat lung cancer?
Okay, so treatment in cancers, we always say surgery, radiation, and drug treatment. In terms of lung cancer surgery, the main thing is about the keyhole surgery, but that has been around for many years. So in the lung cancer surgery, it's very painful. In the traditional thoracotomy, the open surgery, because you need to get access to the lung, and you need to put your hands through the ribs, so that you need to spread the ribs, and sometimes you need to crack the ribs, so it's very painful and it takes a long time for the pain to go down. But keyhole surgery will enable you to do the surgery without spreading the ribs or without cracking the ribs, so patients recover faster in a very general way. In radiation, because of technology, nowadays we can give very focused radiation to the tumor without exposing the surrounding lung to the side effects of radiation. So we can actually reduce the damage to the normal lung with focused radiation. But the major breakthrough in the major advances in lung cancer treatment is actually in drug treatment.
Yeah.
We used to treat lung cancer with chemotherapy, but a lot of people associate chemotherapy with something that has a lot of side effects.
But people are scared of chemotherapy.
Correct, yes.
Because of side effects.
People think of chemotherapy, they think of hair loss,
Yeah.
they think of vomiting, they think of nausea, they worry about reduced immunity and risk of infection. But even chemotherapy, there are big advances. In lung cancer, for example, the common chemotherapy that we use as first-line treatment for lung cancer nowadays, there will be minimal or no hair loss. Almost nobody vomits from the first-line chemotherapy, and the reason is two: we have better drugs, and we also have better supporting medications. We have better medications to reduce the chance of vomiting. We have medicine to support to reduce a drop in the immunity so that people do not vomit, and people vomit less and do not develop infection. So, but one of the big breakthrough occurs about 12 years ago when targeted treatment was first discovered. So we used to treat all lung cancer similar with the same chemotherapy, but with better technology, we are able to understand the process of transformation to cancer better. So now we can test for genetic change, the genetic change of the mutation that caused a patient's tumor lung cells, normal lung cells, to turn cancerous. If we can determine the genetic change that transform a normal cells to cancer cells, then we can design a drug specific to block the genetic change to stop the cancer from growing. That's the basis of targeted treatment. We find the target, we find the we find the mutation, we find the genetic change that causes the cells to turn cancerous, and we design the drug to block the genetic change. And so far, this has been proven very effective. So the first genetic change that drives the lung cancer mutation was discovered in 2004, about 13 years ago. And with that, we have drug that's specific to target that. And so with targeted treatment, because it only targets the cancer cells without affecting the normal cells, number one, they are very effective. If we have 10 patients, lung cancer patients with that target, if we use targeted treatment, 9 will improve. Then the control tends to be much longer than chemotherapy. Normally chemotherapy we can control for 6 months, 8 months, and the disease progresses again. The targeted treatment we can control for 8 months, 1 year, 1.5 years, much longer. And because it targets the cancer cells, it doesn't affect the normal body cells. There's very little hair loss, very little nausea or vomiting. So the first target was discovered 2004, and since then there are more and more targets of genetic change being discovered, and there are more and more drugs. Okay, so there are more targets, more drugs. Even with the same target, there are newer drugs and all these things. So that nowadays, targeted treatment is an important and established mode of treatment for lung cancer patients. And the challenge is also, we need to find the target, we determine which patient, which tumor has which target. So that it boils down to you need to have very good laboratories, those molecular pathology for us to, and usually this genetic change it is picked up by pathology department. So nowadays we can test for a lot of mutation. We can test for single gene mutation. If we want to, from the single specimen, we can even test for 200, 300 genetic alterations at the same time. So targeted treatment is one of the most important development in lung cancer treatment for the past 10 to 15 years.
Right.
But just as interesting, as important, over the last 2 to 3 years, immunotherapy is coming in the treatment of lung cancer patients. We can have better treatment, we can have better surgery, we can have better radiation, we have better chemotherapy. You're right in the sense that if we can prevent, it's even better. Actually, lung cancer is the one of the easiest, or in some ways most difficult cancer to prevent. When I say easiest is if you can stop smoking,
Right.
then the lung cancer incidence or prevalence will drop dramatically. In fact, we see the reduction of lung incidence incidence in a lot of developed countries where the number of smokers come down, the number of new lung cancer patients will come down. So in fact, it's easy, just stop smoking. But if you talk to a smoker or a group of smokers, it is very difficult to get a person who is smoking to give up smoking. The reason is the nicotine in the cigarette smoke causes addiction. And it's very difficult to get rid of addiction. That's why nowadays we have nicotine replacement therapy. So instead of addicted to the nicotine in the cigarette and the harmful substances, we switch the addiction to just pure nicotine, which is less harmful, and hopefully with time we can reduce the nicotine and wean them off. So in fact, like we can only prevent a cancer if we know the cause. In fact, we know in majority, 85% of all lung cancer associated with smoking. So actually, it's one of the easiest way. But that's why a lot of effort has been put in to stop smoking, to reduce the exposure of the population to cigarette smokes. Like we increase the price, we reduce or we ban the advertisement, and all these things is to try to reduce exposure to cigarette smoking. But if you cannot stop smoking, is there any way that we can pick up lung cancer in the early stage? For breast cancer, we know we can do mammogram.
Yeah.
For cervix cancer, we do pap smear.
Pap smear.
For colon cancer, we do colonoscopy. But lung cancer screening is a little bit of the problem. we have been trying to see whether regular chest X-ray can pick up lung cancer at the earlier stage, and as a result, treat them in the earlier stage and reduce the number of people dying from lung cancers. But all these trials have been done in the 70s and 80s, and have been shown repeatedly, regular chest X-ray is unable to reduce the risk of dying from lung cancers. But the breakthrough came out a few years ago, quite a number of years ago, where CT scan screening. Actually, CT scan screening, at least in the trial done in America, compared to chest X-ray, has been shown to be able to reduce the chance of dying, the risk of dying from lung cancer in people at a fairly high risk. In those people aged in that trial, active smoker or recent ex-smoker who are more than 55-year-old. So they just get the group of people who are at a high risk of lung cancer, and they do and the CT scan screening has been shown to be able to reduce the risk of dying from lung cancer. The problem is CT scan screening. So CT scan screening for lung cancer is recommended in US, but not commonly widely adopted by other countries because there are issues. The issue is one of them is the cost. CT scan is much more costly than a mammogram and all these things. Number two is the amount of radiation. The amount of radiation in CT scan is much higher than a mammogram. Number three is, in mammogram, if you pick up something suspicious, it's easy to do a biopsy. You can do a needle biopsy very easily. But if you pick up a small nodule in the lung, it's very difficult to do the biopsy. Too small, we cannot do a needle biopsy. And if you want to biopsy, you need to do a surgery, which is a big undertaking. And also in population who are smokers, sometimes they pick up a lot of nodules which are not cancerous. So it creates a lot of anxiety. So there's a lot of debate on, number one, the true merit of CT scan for lung cancer screening. Number two is, in which population should we do the screening? Number three, if you do screening, you start with age 55. You do a CT scan every year. Do you do it for 3 years, 5 years, or the next 10 years? If you do it for a long period of time, the cost will go up, the amount of radiation will go up. So CT scan screening is a potential tool for early detection of lung cancer patients. I would consider CT scan screening in patients who are at a very high risk of lung cancers. But before you do the CT scan screening, we have to discuss with the patients the pros and cons. We worry is it may generate some anxiety. You pick up a small nodules that you cannot biopsy. What are we going to do? So these are the issues, but I think CT scan screening is probably the way to go.
Other than treatment, I think counseling is also very important for cancer patients. And what would you suggest for that?
Okay, I mean, if a person have cancer, any cancers, I'm sure there will be a lot of questions, a lot of anxiety, and it starts from the moment that the patient is being told he has cancer, or even before that. For example, for lung cancer patients, you present with cough, you present with blood in the sputum, then you go and see a doctor there, they ask you do a CT scan. Then your mind will start going, do I have cancers or not? Then the next question they usually have is, at what stage? Is it curable? Then the next thing is, what treatment do I need to go through? Surgery, will it be very painful? Do I need to stay in the hospital for many days? You need chemotherapy, where I have also a lot of questions. So even in the patients who have successfully undergone early stage lung cancer, have a curative surgery, recovered well. But these patients will always face the issue of, will I get the recurrence? When do I get the recurrence? Am I truly cured? So you can see a lot of patients, a lot of cancers, they have lots of issues. So in a way, we will try to, one of the ways to help is to give them the necessary information our usual recommendation is give as much information to patient as possible, including the treatment options, including the side effects and the outlook. It's better to be in the know than in the unknown, where you worry what may happen. At the same time, our nurses who give the chemotherapy, they usually spend a lot of time in our clinic. So the nurses will be additional source of information where the patients can talk to and get in the information. We also have our own counselors in terms of psychological support and all this thing. And we really try to get the family members in because it's not the patient who will face the cancers, and they usually need the support of surrounding people, the families, and the friends. So we try to get everybody in to try to get as much help as possible. So there are many issues with lung cancer patients, even if they're cured.
With your permission, now we will go for a short break. Dear viewers, now it's time for a short break. We'll be back soon. Please stay with us. Dear viewers, welcome back to the health show Doctor's Voice. Thank you for being with us. How do you provide multidisciplinary care to cancer patients?
Okay, so in a way, nowadays, especially in those complex cases, in lung, it will be stage 3 lung cancer patients, where the treatment may not only involve chemotherapy or may not involve surgery, they may involve a combination of surgery, radiation, and chemotherapy. In a way, we have a group of doctors who are able to work very close together. Group of doctors, I do not mean only medical oncologists, but I mean surgeons and radiotherapists. Because we have worked with each other for a long time, we know the considerations. For example, I'm a medical oncologist, I will know the considerations of radiation, and I know the considerations for surgery. We also have a platform for multidisciplinary discussion, like a Tumour board, where cases are presented and discussed, where the surgeons, radiotherapists, the radiologists, everybody's around. So if you can get everybody around together, it's easier to discuss. And once you do that on a regular basis, then we sort of come up with a practice pattern that everybody knows what the other discipline would do. So in a way, that's good, and so that we are not working in silos.
And what is the holistic approach for cancer patients?
Okay, so we don't talk about, just talk multidisciplinary, surgeons and radiation therapists, but we also have counselors, dietitians, and all the supporting staff. So that we have to look at all aspects, not only treatment, in the daily activities, the physiotherapist, the dietitian, what they're supposed to, and also we talk about these patients, if they are well, they have to be reintegrated into the society, the families, and all these things. So you are right in the sense that we only do not look at the medical issues, then we have to look at other things, the social, the dietary, the physical, even the financial situations. Especially now you know that all the treatment, the cost can be quite high.
How people from Bangladesh can communicate with you for advice on cancer?
Okay, we have various ways. So number one is we have an office in Dhaka, right? So they are available, so they can actually call up and go to the office and get whatever question they want. The office may or may not be able to answer all the questions, but we have very established ways of communicating the medical information. Then we can also give our suggestion to the office, and in that way the office can engage the patients. So we have a helpline as well. They can email directly to CanHope sort of thing. Yeah. So there are various ways.
In the meantime, we came to know about chemotherapy, and would you please tell a little more about radiotherapy?
Okay, so at least in Singapore, I'm a medical oncologist. I only give chemotherapy. I'm not trained in radiotherapy. I would just talk about radiotherapy for lung. For example, radiotherapy is local treatment. So if there's issues in the lung, we can radiate the lung. If the issues in the brain, we can radiate the brain. But if a metastatic disease, if a disease that spread via the bloodstream, gone to various organs, then we're not talking about radiotherapy. In lung cancer patients, radiation or radiotherapy is used as a primary treatment in those who are locally advanced. That means they remain in the lung, in the chest, but we are unable to do surgery. Then we can give radiation, and there's still a chance of cure with radiation. But usually, if the patient is fit, we add on chemotherapy to increase the chance of cure. The best way to control brain metastasis is actually radiation. If the patient had painful bony metastasis at one or two sites, radiation is a good option to eradicate the tumor in the area, to reduce the pain, and also to prevent fracture. And we used to have, but nowadays there's a lot of advances in radiotherapy technique. So we used to have 2D, now we have 3D, we have 3D conformal radiation. Now we have radiation with guidance. So what type of radiation we use depends on the indication. For example, I also do head and neck cancers. For head and neck cancers, let's say for nose cancers, which is behind the nose, where a lot of nerves are involved. So if you need a very accurate radiotherapy technique to prevent radiating the surrounding important structures, then we use 3D conformal with guidance. So the type of radiation we use will depend on the indication.
Actually, today we came to know a lot of new information, advanced technology from you, and thank you so much. Thank you for your cooperation.
Thank you very much for having it. Thank you.
Hi viewers, now we are at the end of the show. See you in the next episode. Till then, stay well and keep your eyes on ACTV. Thank you.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spared no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive. And this includes some lead-lined rooms, which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from the IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing, so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex, difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. We have the best of the best working in this hospital.
The clinic's actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile, and that's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.